Something I watched pre-pandemic, looked at it, went, no way, not here, couldn't happen. It was a movie. I watched Contagion post-pandemic, actually at the height of it, and I said, wow, how naive was I? You were never naive on this. What do you think about that movie?
At the time, the people who made the movie consulted intensively with infectious disease experts as well as with the CDC, and we all said this is realistic, this could happen. It seemed over the top, but tragically, of course, this type of contagion is happening right now. But it was exciting to connect with the movie makers and to get to meet with Kate Winslet as part of the production.
You said you had some input, of course, on the role she was playing in helping her to, in essence, capture what you do. Also, some involvement of the CDC facilities as well, correct?
That's right. You know, she was trying to get into the character's mindset and sort of understand what type of person goes into this work and motivators and so forth. We used to joke though, because she met with others and talked about the science and the epidemiology. She met with me and wanted to know, what would I wear on an outbreak? How would I do my? It was a little bit embarrassing, but the movie came out really, really well, I think, for and now of course everybody understands that these viruses can go from animal to humans and spread around the world pretty much within days, and just devastating. So we're all very, very interconnected, and we all need to be prepared. Every nation, every community, every person.
So as Kate Winslet was trying to encompass what you actually do, the job that is a huge part of your life, I would imagine. Tell me about the role of hunting viruses. As a kid, did you say, I'm going to go chase the dangerous right now? Because this is something I would run the opposite way from, and clearly you ran towards.
No. As a child, I just wanted to be a doctor, and that was the big plan. But I came to the CDC for what's called our Epidemic Intelligence Service or Disease Detective Program, really just to take a break from the clinical world for a couple years in training. And I just found that I loved the work, the sleuthing of being a disease detective, but also the impact that we could have, the ability to change policy or save lives was just extraordinary. Sometimes it's a mystery that you're solving in epidemiology. Sometimes it's plotting through a research project or a tracking surveillance kind of project. But the CDC was just a wonderful place to work for me anyway.
I guess in a perfect scenario for a job like this, you would want to not have the work, right? You would not want to have these pandemics to chase, but we know the reality is one happens and then another one follows up. Governor Cuomo just speaking about this recently, trying to get New Yorkers prepared for what could happen in the future. Take a listen to this.
And I hate to say this, there will be a next time. Anyone who says with COVID, well, this is one and done, this is one in a lifetime. No, my friends.
So now we're talking about preparedness classes being offered in partnership with Cornell to get New Yorkers prepared. Doctor, the last year we know has opened the eyes of so many of us who, like me, watching Contagion, naive to all of this. How do we make sure that we don't fall into that trap again? What do we do today, now, to make sure that we are better prepared for the next one?
Yeah, there's so many things we can be doing. And one thing that's really important is to remember who has been hardest hit from this pandemic. We've seen communities of color greatly disproportionately affected, with more hospitalizations, more deaths, more loss of income, more loss of livelihoods. And we know that we need to make a major investment in these communities as well as in the public health system of the nation. People thought that the U.S. was prepared, but we had so much vulnerability. So we need to strengthen the public health workforce, modernize our data systems so that we are not always behind the virus, but we can actually predict and forecast. And we need to really build those bridges between public health and healthcare, as well as between countries around the world. We know that the first SARS epidemic in 2003 was partly a problem because China didn't report it and covered up the problem. We know that Ebola in West Africa could spread around the world without a strong public health system in those countries. So we really can't look at this just as an American issue, but need to remember it's a global issue.
And that was